Well, every 3 minutes, someone will visit an ER with a reaction to food. It's a growing problem that researchers estimate affects up to 15 million Americans. Even more startling, it affects 1 in every 13 children. Joining me today to talk about what you need to know about dealing with food allergies is Dr. Tran, a pediatric allergist at Children's Memorial Hermann Hospital. Good morning, and thank you for being with us today. Such an important conversation to have. We brought in some EpiPens today to talk about how important it is to have these on hand for anybody who has life-threatening allergies. The problem, from what I've learned and through some of my research, is that 25% of anaphylactic shock happens for the first time at school. Parents aren't even expecting that to happen.
That's right. So food allergy can be mild with just hives, or it can be extremely life-threatening, affecting your breathing and your heart. Being a food allergy sufferer like myself and having my son who also has peanut allergy, I know how that feels. It can be really anxiety-provoking because it can happen rapidly, it can happen suddenly and unpredictably, and it can affect your breathing. So it's extremely dangerous, and most of the time parents don't know what causes. So I developed a mnemonic to how to approach it. It's EAT. E for exposure, so first identify what is the trigger, and you need your allergist to help you figure that out. A, develop a strategy for avoidance, how to avoid it, and then T for treatment, have a treatment plan so upon accidental exposure, because the sooner you get the treatment in, the better you are at protecting yourself from these life-threatening effects.
And so you actually deal with this on two bases then, your very own family, your son, and that's your job to help protect children.
That's
you were
correct.
talking about that plan, and I think it's really important for parents to know with school starting that there's some very important paperwork that you need to know about. There's something called a food allergy action plan.
Right.
But there's also a 504 plan, and from the parents I've talked to, a lot of them don't realize that that's an option, and you think that that's a really good thing, especially for someone who has life-threatening allergies?
Right. Yes, the 504 plan basically mandates that any school that gets federal funding needs to provide a safe environment for kids with disability, physical and mental. So kids with allergies, they need to make sure that the kid, especially with severe allergies, make sure the kid doesn't get exposed to accidental exposure to peanuts.
We also want to talk about EpiPens, how important it is to know how to do it, even if your own child doesn't have allergies, to know in case you needed to help somebody else. So you're going to show us. So we're going to actually take this little piece of adipose tissue, and we're just going to walk through our viewers of how you would go about doing this.
So there are two type of, well, there's many, but here's the two common ones. This one's been out there for a long time, and basically when you get one of these twin packs, it comes with 2 epinephrine and then a demonstration for you to practice. So in an event where your kid is developing an allergic reaction, so little rash here and there is okay, you can give the kid Benadryl, but any reaction that gets you scared, if you yourself is heart racing, get this epinephrine in early. So when it comes out, there's a orange and then there's a blue. So the blue is you need to first remove this so that you can activate, because if you don't remove it, it prevents accidental injection. So first you remove it, and then you want to hold it firmly like this. Try not to get into a habit of holding like this, because you can accidentally get nervous and have your thumb on the orange, and when you push down, you can inject yourself. You hold like this. You don't need to jab it. Get to the upper thigh to where the meat is, and then you just push down firmly on it, and you press down on it. So you want to push down on the outer and press down, and it injects. And then the needle then gets covered up.
And then how are you going to hold it? How long am I going to hold it down? Is it 5 seconds?
5 to 10 seconds.
Oops,
you can just count.
4, 5, and then you're out, and that's it. Now, once you do this, everyone needs to know that you have to call 911 immediately. This is, you need medical help after doing that.
That's correct. That's correct. This just provides you with temporary relief and stop the blockage of airway and maintaining blood pressure until EMS come and provide you with support. The second one is there in case the first one malfunction, or in case within 5 to 10 minutes and EMS hasn't come, you use the second one.
All right, on our 9 o'clock news tonight, I'm going to show you how this new talking one is making a huge difference, and so we're looking forward to that. All right, Jose? I'm going to talk about what's coming up next on Fox 26 News, and that is an in-depth look at what schools are doing to deal with the growing threat of food allergies. Yes. We'll talk more about that tonight at 9.
And now for something completely different. If your iPhone